Hi, I'm Dr. Rick Bosnich and welcome to Newen Institute. At Newen Institute we specialise in hair restoration and cosmetic medicine. Today I'm going to talk to you about the importance of scalp massage exercises prior to undergoing follicular unit strip surgery. When we perform follicular unit strip surgery, which is a form of hair transplantation surgery, an area of hair-bearing skin from the back and the sides of the scalp is removed. The width of tissue that can be removed from the scalp is determined by the flexibility or the elasticity of someone's scalp. The more flexibility that there is, the wider the strip that we can take. On average, we can take strips which vary in width from around 1 centimetre up to 2 centimetres in individuals with very flexible scalps. The wider the strip that we can take, the more follicular unit grafts we obtain, and therefore the greater number of hairs that we can transplant into any given area of hair loss. This will result in greater densities and greater and better aesthetic results overall. So it is in your interests to increase and improve the flexibility of your scalp prior to surgery. So how can this be done? It's quite simple to do, and it's via a series of simple exercises that can be done in the privacy of your own home or at the office and at work. I need you to perform these exercises for at least 2 to 6 months prior to your surgery, and it is preferable if you perform them for 4 to 6 times per day per area for 2 to 3 minutes at a time. It is better to perform these exercises for short durations regularly with adequate pressure rather than trying to do it for long periods of time and not applying enough pressure. This will be less effective and not result in the elastic changes that we require. So I'll quickly demonstrate to you how you can perform these. It is best if you perform them at the back and the sides of the head using the palms of your hand. So I would get you to tilt your head forward slightly and apply firm pressure up and down at the sides of your head, backwards and forwards, and in circular motions for 2 to 3 minutes at a time. It's important that you apply good, firm, strong pressure in all directions in this area, up and down. If you do that 4 to 6 times per day for 2 to 3 minutes at a time, you'll get good improvement in the stretch and the flexibility of your scalp. Now, for the back of the scalp, it's a little bit more difficult. Generally, what I recommend is that you interlock your fingers and tilt your head back and apply upwards and downwards pressure with your interlocked fingers, like I'll demonstrate. So interlock your fingers, tilt your head back, and nice firm pressure up and down for 2 to 3 minutes at a time. If you like, you can try and apply pressure with the palms of your hands. It doesn't really matter as long as you're applying firm pressure for 2 to 3 minutes at a time. Now, you may not notice any change in your flexibility for the first 2 to 3 weeks of completing these exercises, but it is important that you continue to perform them, as you will notice changes in the flexibility after this period of time. In addition, by performing massage exercises to these areas, we improve blood flow and decrease tension on wounds at the time of closure. These are all good for wound healing. Overall, by performing these exercises, you have nothing to lose, but you have a lot to gain in terms of increasing graft numbers we can obtain at the time of surgery and having better wound healing. So I would encourage you to perform these as I've described. If you should have any questions about how to perform these exercises, you can contact us at our clinic at www.neweninstitute.com.au.